is Raymond Williams.
My name is Ilker Buchanan.
My name is Alan Lupiani.
I actually felt it when I was 11 years old. So I was at a pool party with my friends, and I had gotten out of the pool, not doing anything. So went into the bathroom and I wanted to urinate, and unfortunately nothing came out.
In my mid-20s, I had begun to develop what is now known as a stricture.
Well, we were lucky enough to find a very good pediatric urologist in Rochester, Dr. Rabinowitz, and he gave us hope that with another dilation procedure, that I would be okay. And he did the second procedure when I was a senior in high school, and it was successful.
What they did basically is they did what they would call dilation, where basically they would kind of numb the area, and they would use instruments. It was a rather rubber tubing type thing, and they would basically insert that and then screw another piece on and insert that and kind of forcing it to open.
The doctor at the time did say there was about a 50-50 chance that this problem would reoccur in my 40s.
And one of the senior doctors there had performed surgery. Brilliant man, brilliant doctor. However, what he performed was a incision where he would cut the two ends of the urinary tract and reattach them together, and hoping that this would just heal it perfectly, cutting out the bad part. After that surgery, 2.5 years later, my problem reoccurred again. Now I saw blood coming. Now I got really nervous.
And what they would do is they would identify where the stricture was located and insert a piece of the urolome, which was designed to go in narrow, and then when it's released, kind of spring open. It'll keep it open. I won't have to worry about it. So I agreed to have a urolome inserted, and for the first few months, I was able to void without any issues. At some point, the same feeling started to come back.
I had a real shortness of urination, and the symptoms also included not feeling empty in the bladder. And so I was concerned whether it was a prostate type issue or something else, a recurrence of an old problem.
I went to a more well-known urologist in Maimonides Hospital in Brooklyn, and he had suggested that I actually undergo surgery, where they would basically cut away the scar tissue. The way it was explained to me is that throughout the years, I had developed scar tissue that was narrowing the urethra.
And I wanted to go to the restroom. I couldn't go. And it was the worst pain I've ever felt at that moment in my life.
It's not something that's noticeable right away, but if you know what normal feels like, you have this understanding of abnormal, and you could feel the abnormality coming on.
So I met with Dr. Purohit, and we explained to each other. I explained my problems, and I explained my history to him. And he came to me with such a warm, inviting personality that I've never experienced before. And now I said to myself, all right, this doctor is not going to be the same doctors that I had in the past, where they might just recommend me to another doctor.
I thought, I've seen the greatest. Well, I've been to 5 or 6 different facilities where they're all the greatest, and they're all going to fix my problem, and I'm going to be great, and I'm going to be, dancing in the streets and only to be disappointed. And just the way he said, no, this guy is really good. He knows his stuff. I'll get his number for you. And I thought, okay, it couldn't hurt. I mean, I was just going to walk into Lenox Hill and say, I've had episodes. I need help.
I felt well taken care of once I visited Dr. Purohit's office. Coming by, was very organized, and I sensed that I had already been told by Dr. Shariat that Dr. Purohit was one of the best urologists for this type of procedure, which I was to undergo.
What Dr. Purohit suggested to me was that they were going to do something that where they would basically harvest material from my body. And quite naturally, I thought, my thigh, they're going to take a vein or something. But it's just, no, we're going to try to avoid that. We're going to go after material that is as close to that area as possible. What are the two things that the cheek and the urethra have in common? They're always moist. There's always some kind of movement. It needs to be flexible because, when your penis becomes erect, the tissue needs to be able to expand, decrease. And the tissue inside your mouth kind of does that on a daily basis.
Dr. Purohit suggested 3 different options. One was a normal dilation. The second procedure was a buccal graft, which was taking some tissue from my cheek and reconstructing the urethral canal. And the third option was to cut out the disease and do an actual reconstruction of my urethra. The option I had was the urethral reconstruction.
This was a procedure where he told me that there would be about an 85% success rate. And I said, let's do it. Let's do it because that is the best success rate, that chance that any doctor has ever given me.
So the end-to-end procedure that Dr. Purohit performed on me at Cornell went pretty much without a hitch. I went in the morning, first thing, was well taken care of, processed as far as paperwork and insurance forms, and pretty much on schedule. The nurse did the pre-op for me, taking the blood, and we went right into surgery as scheduled. I met with a doctor prior to going in and felt very confident and comfortable that everything was going to go just fine. When I woke up, there were smiling interns helping me onto the gurney, taking me back to a very comfortable hospital bed at Cornell Wheel.
After my surgery and after the catheter came out, it was a struggle, meaning that the incision from the testicle area had still had not been healed. I had home nurses coming, providing me providing the services needed to disinfect the area, keep the area clean.
At first, I was always touching with a harvester, like, hey, that's not like you said, but you know what? It's fine. I don't notice it. Doesn't get in the way of anything. I don't even notice it now. I've got to actually feel it to notice that that's where they harvest it from.
After the wound area initially healed, then I had experienced no problems whatsoever, and I couldn't believe it, and I still can't believe it now. It's been 4 months since my surgery, and I'm feeling so great. It's phenomenal. And I'm so happy that Dr. Purohit had conducted the surgery. Yes, there's a bit of tightness, but that's minimal. That's nothing. But it healed perfectly. It healed absolutely perfect. My flow was absolutely phenomenal. I was so happy with the type of surgery that Dr. Purohit did and what we agreed upon, how we decided to take out the skin graft and reattach it to the urinary lining. It was the best decision that I've ever made.
Within 2 weeks, 3 weeks, I was just about back to normal, and today I would say that I never realized that I had surgery in that regard.
As far as after the surgery is concerned, my sexuality was limited, of course, and I'm free to speak about this. But slowly but surely it came. And everything is running well, and all systems are go.
Since my surgery, I've been able to urinate like I've never been able to urinate as long as I can remember. I have a very solid stream. The tests have come back very positively. I feel like my bladder is emptying. I'm not very conscious at all anymore of issues relating to urination. And for the first time, last week actually, I stood up in a men's urinal, public bathroom, and stood at the urinal and was able to urinate.
They treat you with respect, They help you. They go out of their way to help you in your time of need. They call you. They ask you how you are, how you're doing. I mean, there was always a phone call from Dr. Purohit's office. Oh, how you been? How you doing today? And anytime I needed something, Dr. Purohit and his staff were always there, which is, to this day, as you know, many doctors are very hard to get in contact with. But that's not the case with Dr. Purohit. He's always available for his patients.
They understood the reason why I was here, and they understand why everyone is here, and understand that these are the things you need to do while you're here. It works. Every time you wanted to do what you wanted to do, it does it. And that is something that I couldn't begin to fully project the appreciation for.
I felt like I was in the best hands I possibly could have been, and as far as getting the end-to-end treatment, if it was possible, I'm glad that the doctor had decided to do that procedure, because I feel like it gives me the best chance for a full recovery for the rest of my life.
Before you consider anything with a urethroplasty or having anything done with, let's say, your stricture, please consider, or at least make a phone call to Dr. Purohit, because you're in the hands of one of the best doctors in the field for this type of surgery.